everyone, my name is Minsung Ellie Kim, and this is my presentation on reopening schools during a pandemic. So a little bit about me, I go to Clarkstown High School North in New City, New York, and I'm a rising senior. I've actually lived in 3 different countries. I was born and raised in South Korea. I lived in Vancouver, Canada for 6 years, and now I'm here in New York. I play the flute. This is a picture of me at Carnegie Hall, September of 2019, and I also love to play the flute for my school's pit orchestra. I love to write, specifically poetry, and I love to paint. And over quarantine, I actually started an art business and raised some money for COVID relief. But the one thing I'm really passionate about is STEM education and empowering girls to receive a higher education in STEM. I actually started a STEM summer camp that I'm hoping to follow through into the fall, and I'm doing a research project on elementary students' interest in STEM. And because I love education so much, my topic has to do with schools. So why is this a global issue? Reopening schools during a pandemic is a topic that relates to global health because education happens everywhere. Whether it's in Korea, Australia, or the United States, education is embedded into the daily lives of people in many different societies, and it is very much a universal experience. It also impacts different kinds of people, ranging from 4-year-olds to adults and beyond. In the midst of the coronavirus pandemic, as we have lived through and know, schools are a place of great concern because it is where many different people come together, making it a vulnerable place for viruses to spread. You've probably seen these 3 most important, I think, CDC guidelines to protect yourselves from the COVID-19 virus. The first one is to avoid crowds in poorly ventilated spaces, staying 6 feet from others and social distancing, and then cleaning and disinfecting surfaces. As you can tell, you can see that classrooms and schools are the ideal place for COVID to spread. And this makes it really hard for schools to open, but it also makes schools a very important place to study when talking about pandemics. When dealing with pandemics, the most important part is trying to stop spreading between large groups of people. Places of education, such as college campuses, are where a large group of people come together, so it is a vital place to study when talking about global health. Schools are also a place where health and safety can be better understood. Education is mostly a universal experience, and by targeting health and safety regulation towards places of education, the welfare of the state and even the world can be better helped as many groups of people can come together. And finally, education is timeless. It will never stop. Health and safety in places of education will continue to be a topic that is discussed around the world for years to come. So I want to talk a little bit about my experience. In the spring and summer of 2020, I was a student representative for my school district's reopening task force committee. I was able to work with district administrators to talk about policy and intertwine them with my discussions with doctors and physicians on the topic of health and safety. While my experience was limited to just one school district, the school district I'm in, similar work regarding reopening schools during a pandemic were happening across the world. So some topics that I discussed while I was a part of the committee were hallways, because hallways are a place where students love to talk and chill out and hang around. You guys probably know what that's like. And we talked a lot about how to flow the traffic to maintain social distancing. Another important topic was transportation, specifically buses, and how to accommodate the CDC guidelines within the buses, how many kids can be in the buses at the same time, and what kind of system that would be. Furthermore, we talked a lot about elementary level students who might have a different experience with the COVID-19 vaccine just because COVID-19 guidelines just because they are younger, whether they'll be comfortable wearing masks and face shields, and whether we would need bigger classrooms, and if they would have to just stay in their seats the entire time. Another topic of discussion were nurses' offices within the schools, how to isolate the students who have COVID symptoms or potentially have COVID, from other students that come into a nurse's office and don't have COVID, how to keep the nurse's office safe for all students. And another topic was students with disabilities and special needs who might feel uncomfortable sitting in one place, who might feel uncomfortable with the barriers, who might need to lip read and have trouble with communications and communicating with their teachers if they're wearing masks. So those were important topics that we talked about. So the question is, do we close or not close the schools? And this is a topic of public health as well as a hot political topic. As we discussed reopening schools, there's been a lot of news on whether we should close schools or not close schools, and this is the big question. While there's definitely overlap, I wanted to identify and talk about some unique ways different countries have handled reopening schools during a pandemic. One of the more unique ways South Korea has conducted academic testing was to conduct them in outdoor stadiums. This is a pretty ideal environment to prevent the spread of COVID because it is an open air environment with ample space between test takers. Schools in the UK have small and staggered classrooms similar to many other schools around the world, and with ventilation and social distancing. In Scotland, they actually quarantined returned library books for 3 days. Many universities and colleges have been using COVID symptom tracking apps developed by researchers at universities and colleges in the United States. Just selecting one, an app developed by researchers at Harvard T.H. Chan School of Public Health asks contributors to answer a few simple questions on their current health and to check in every day to report how they're feeling and to list any symptoms they may be having. So what comes next as we finish up this school year and we're looking forward to next fall with vaccines coming out? What comes next? What is the policy for the next school year? And college campuses generally fall into 4 categories. 1, they could require that vaccines. They can 2, offer incentives for voluntary vaccines and have students get immunized voluntarily. They can 3, not require the vaccine at all. And 4, a lot of colleges have been just waiting and seeing what happens this summer and early fall. In terms of children and teens, the vaccines are now available to 12-year-olds, and the question is whether they'll be available for kids younger than that. While globally COVID-19 infections are still much lower among children than among adults, these are still questions that will greatly impact how schools approach the next school year. 41% of young adults ages 12 to 17 already received the vaccine, and there are signs that the vaccinations among tweens and teens may increase. As vaccinations are distributed, it will start a new phase in the reopening schools discussion, and there are still so many more questions and decisions to be made. Thank you so much for watching my presentation and listening to what I have to say. I really appreciate it. I also want to send a special thanks to my school district, Clarkstown Central School District, for letting me be a part of the reopening task force committee last spring and last summer. Thank you again for watching. And if you have any questions, please feel free to email me. Hope you have a good day. Thank you.